Hello coders, this is a quick review of coding for pregnancy, childbirth, and puerperium from your chapter 15 in ICD-10 coding. Remember, ICD coding is only for diagnosis. I always want you to remember the D is always used for diagnosis. When coding for pregnancy, you have to know what main terms you will be looking for in your index of the coding manual. The most common terms for a pregnancy in the index are pregnancy, which is the most important term when you are looking for anything to do when a pregnant lady presents to the doctor in the hospital, in the office, having anything to do, even if it's a office visit or if it is any complication that is associated with pregnancy. When the baby is being delivered and the mother is in labor, the main term will usually refer to delivery. So this is a main term when you're looking for anything to do when the patient is in the status of delivering a baby. How many babies are born or delivered? You have to find the outcome of delivery as your main term. And it is confusing. So you want to prepare yourself to be ready to understand what main term should I be looking for in the index. When we use pregnancy, there are a lot of things that we are looking for under pregnancy when we have situations such as complications. Maybe there's HIV infections, maybe there's hypertension associated with pregnancy, maybe there's diabetes, ectopic pregnancy, multiple pregnancies, weeks of gestation, supervision. All of these terminologies, or actually subterms, will be under the main term pregnancy. Coding guidelines are always very important, but even more important for pregnancy because everything depends upon a guideline. And if you don't have any idea of the guidelines, it will be very complicated for you to follow and find the correct code. Chapter 15 have a sequencing priority over other codes. That means if a patient presents with pregnancy, we are always going to code from chapter 15. There can be additional codes that can be used. Let's say the patient has some kind of fracture. We can code for the fracture, but there is also a code that will be from chapter 15 that is already giving you the code for the fracture, but additional codes for certain other things that are not associated with pregnancy can be used here. Chapter 15 codes are all for the mother's record, okay? It is not going on a baby's record because when you work with pregnancy and delivery and the baby, there are notes and guidelines to follow. Whom are you coding for? Is it the baby or is it the mother? The sixth character in chapter 15 codes are usually to indicate the trimester. The trimesters are first, second, and third, and it is very essential that we follow the documentation to know exactly what trimester the patient is. The final character of trimester should be based on provider's documentation. Everything is documentation. You as a coder are not creating anything. You are only following doctor's note. Ages are very much important. If the patient is under 16 or over 35, it is considered to be a high-risk pregnancy. I forgot to mention that here. But these ages are high-risk pregnancies, which is considered especially at the time of expected delivery. Now remember, I spoke about outcome of delivery, which is the main term in situations when we are discussing the delivery of a baby after the pregnancy. Z37 is the outcome of delivery that should be on every mother's record, especially if it's a normal baby. Z38 is not for the mother at all. This goes on the baby's record. So make sure you are not using Z37 to go for the mother's codes, and this sometimes can be confusing and a tricky question on CPC exam. Z39 is a principal diagnosis code when the baby is delivering somewhere, when the mother is delivering a baby anywhere else but the hospital, but brought to the hospital for any postpartum care. Remember, the baby is not delivered here, so we cannot code the baby in the hospital, which is a Z37. We are instead using Z39 only for the postpartum care as per your coding guidelines. And this is also if the baby was delivered without any complications. Trimester is very important to understand the difference and the character. Remember, every code in your chapter 15, as you can see right here, the 6th character is usually for the trimester of the pregnant lady, indicating what trimester she presented, what trimester she had certain complication, and the trimesters are divided between 1st, 2nd, and 3rd, starting from the beginning of the last menstrual cycle. That is considered to be the 0 day. So it's going to be from 0 day to 14 weeks for 1st trimester. And from 14 weeks to 28 weeks, it's going to be the 2nd. And 28 weeks after, until delivery, is the 3rd trimester. Unspecified trimester should rarely be used. It is, if the information is not sufficient, we do have a code for undocumentation or non-specified, but it's really not acceptable by the insurance company. So we have to work hard on getting that specified documentation. A pregnancy after 40 weeks is not considered a normal pregnancy, so we have different codes for that. So depending upon the pregnancy and how many babies the mother is carrying, if anything happens during the pregnancy to a baby, we have a number for the baby. Okay, so if we are using 0, that means there is no specification. 0 is usually used for when the mother has only one baby. But if the mother has more babies, then we start using 1, 2, and 3 for the specific baby number. All right, so it depends upon how many babies is the mother pregnant with. There's always a big question about what code is going to be the first listed. If everything is normal about the mother, we do use these very important codes that you want to remember. They're all going to be the first listed code, even if it's a Z34, because Z34 is a routine prenatal visit without any complications. So if the mother goes to see the doctor for a prenatal visit, no complications, Z34 is going to be the only first listed diagnostic code we are going to enlist. Usually Z codes are never the first listed, but in this scenario, yes, it is. If there is a routine prenatal visit with complications of pregnancies, we do not use Z34, we use O09. O, remember there's an O and a 0, so don't get confused. O and 0 are different. So this is an alpha numeric code, alphabet and the new number, and then 2 numbers actually. So always make sure that you pay attention to these digits, because we might end up writing things wrong. So if there's no delivery and the mother just presents with the complication of pregnancy, we will find the code for pregnancy complicated by hypertension, complicated by diabetes, whatever the encounter was for, we will find that particular code. Encounter of a full-term uncomplicated delivery. If the mother presents and delivers normal baby without any complications, we are going to use O80. Let's review a question and understand how to apply these codes. So the patient is admitted in active labor during her 39 weeks of pregnancy. The patient experienced no complications during her pregnancy. Patient labored for 8 hours, delivered a live-born male over an intact perineum. Code the diagnosis only. So go ahead, pause, and see if you can try on your own as to how to find this code and come back to find the answer. So we basically need 2 codes, okay? The O80, which is the delivery. This is your main term, okay? And you will look for childbirth, labor, and normal. This childbirth and labor is actually non-essential modifiers written right next to delivery, which means that you can also see these words in your scenario or questions or documentation written by the doctor. So you can look for delivery as your main term, which is the same thing as childbirth and labor. And under that, you will find normal, and that will be your first listed diagnostic code for a normal delivery. Now remember, this is for the mother. Everything that you're writing here is for the mother's record. Also, the Z370, which is the outcome of delivery for a single live-born. Remember, our main term in the index is outcome of delivery. Under that, you will see single, live-born. You will go to the tabular and confirm. Each of these codes you're seeing here with the main terms and subterms, you have to confirm in your tabular always. I'm not sure if we can use the pregnancy 39 weeks of gestation because the baby's already delivered. But in certain cases, in certain insurance companies, they would like to see that. So you still want to know how to find it. Again, pregnancy, and then look for weeks of gestation under it. It will tell you the 39 weeks, and you see how 39 weeks will always match the Z3A at the end, and then actually gives you the number directly. Infection, HIV infection. Now, so remember, in pregnancy, the mother can also present with complications. One of the complications is HIV infection. The code we use is always O98.7. As you can see, the code is always O. It is chapter 15, and it is for some complications that the mother presents with. If the mother presents with HIV asymptomatic, then we also use the code Z21. If the mother presents with any kind of complications by diabetes, our code starts with O24. Let's review a quick scenario. 25-year-old patient was admitted with difficulty breathing. She has AIDS, is 21 weeks pregnant. Workup reveals pneumocystis carinii pneumonia. What is the correct diagnostic code? This is a very common CPC question, so go ahead, pause, and figure out the answer. You can practice using this information right here if you have not been able to find the information, and everything's given right here with the codes: pregnancy complicated by human immunodeficiency disease, and always confirm the tabular. You always use the B20 codes if the mother has infection. Remember, if she has infection, she's going to be coded as B20. If she is asymptomatic, it is Z21. You also code for the disease, which is the pneumocystis carinii pneumonia. But do you see how 0098 will always be the first listed code? We also always code a pregnant lady with the weeks of gestation, which is 21 weeks, as per the info given to you. So I have a question from CPC exam coding. And remember, we need to learn how to apply the process of elimination. So I have a question here for a quick review. What ICD-10 CM codes are reported on the maternal record for delivery of triplets that are all live born at 32 weeks of pregnancy? So please go ahead, see if you can find the correct answers as posted below, and come back and check your answers with me. If you said A, O30.103, Z3751, Z3A32, perfectly right. Now remember, what does process of elimination means? That means you should know that if you're coding for pregnancy, your first code has to be O, beginning with O. And if you see this combination right here, Z37 followed by O, that is not the right combination. So I automatically know that the only choice I have is A and D. So I'm not going to waste my time looking for C and B. I am going to jump on O30, O3, 103, and 109, which are pretty close to each other, and I can figure out the description between the two and the difference between the two by looking in the tabular list directly. So let's see. When I say O30, when I went to the index, I found pregnancy, triplet, and I found this code with a dash and a point. That means go to the tabular, confirm additional digits. 0 for the fifth digit that I'm looking at right here is for the number of amniotic sacs, because the baby is delivered by 3 babies are delivered. So usually they ask for it, but we do not have the documentation for that. So I'm going to use 0. Sixth is for the trimester, and that is documented for third trimester. So we confirm 103. And then we have, of course, 32, very easy to remember, pregnancy 32 weeks, perfectly fine. I don't even have to check, I know. Z3751 is for delivery in the index, multiple births, all live born triplets. And now I take 2 minutes, you get only 2 minutes to confirm this answer and justify your medical code. I have another scenario for you. Let's see if you can pause and come back and find the correct answer. Again, you can see the answer is posted above, and I have also posted a lot of information for the rationale that you have to use to apply your understanding. So please go ahead, use this information, go to your index, find all the main terms given here, confirm all of them in your tabular list to better apply the process of elimination and create a good concept of how to code for pregnancy. I hope that helps, and I will look forward to speaking to you soon.